This information needs to come from people like yourselves, not me. So today we're just going to go through a whole lot of questions about medicinal cannabis, recreational cannabis, how they overlap, how we're going to be able to use your expertise in the herbalist side, your expertise in the doctor side, to find a solution on why recreational legalization is the right way forward. Yeah? So I'll start with you, Anna. If you could please tell me about your experience, who you are, and how we got here today.
Thanks, Stephen. Thanks for interviewing me. I really appreciate it. So I am a general practitioner. I trained in medicine at Auckland University in the 80s, and I've been a general practitioner for 25 plus years. And I'm relatively new to the cannabis side of medicinal cannabis, but I have been working for the cannabis clinic for the past year. And so I suppose if I have any extra knowledge and authority, it's because I've talked to over 700 patients about medicinal cannabis.
So you actually have in-field experience, you've experienced the medicinal cannabis scheme, you're working in New Zealand, you've also got the 25 years of experience with traditional pharmaceuticals, so you have a very, very strong understanding. That's good. And Erin, could you please explain your experience and how you're here today?
Good, thanks, Stephen. So my name's Erin Hudson, and I've been a herbalist for over 30 years. And in that time, I've had a practice, a naturopathic medical herbal practice, as well as teaching at one of the large colleges in New Zealand. So I first sort of discovered cannabis when a dear friend was dying of cancer, and I went looking for medicine for her. And one of the things that stopped her accessing the medicine was the stigma. Now, this was a woman who was dying, and she still felt a great responsibility, not only for her children, but for her family to, stay on the straight and narrow. So that led me to meet someone called Pearl Schomburg and another gentleman, and I just got a lot more interested in what was possible using cannabis in the form that it was meant to be used, as a whole plant form, and able to, help people in a range of difficult situations. So that's my beginnings.
What kind of patients would you say you're getting? Can you say that it's how do we word this?
So a lot of the herbalists that I work with and a lot of the associations that I'm involved with, they see medicinal cannabis and recreational cannabis, if you like, as very similar. Like it's cannabis and it's medicine. So whether it's used in a medicinal form or as in a recreational form for relaxation, which in turn can help medicinally, it's neither here nor there how that cannabis is used. So in a whole plant form, we see it available for just about anybody, for just about anything. And that's from quite small children up to a very old person. So it's a matter of finding the right strain and the right process for that person to feel comfortable about using the medicine.
So when did you learn, Anna, about the medicinal effects of cannabis? If you've been in the industry for 25 years and you say you've just in the past year been introduced to the medicinal cannabis side of things, what made you take the jump?
I think I'd had some awareness of the role of medicinal cannabis in chronic pain, and also that I attended some continuing education lectures, and then also I had my patients, and some of my patients would come to me and inform me that they had been using cannabis, and some of them had had some quite good results. So that combination of things opened my my eyes to it, but I don't think I was really aware of it. Just how profoundly medicinal cannabis can be for people until I actually started working for the cannabis clinic and hearing all the patient stories.
So you didn't learn about medicinal cannabis at university in your studies? Nothing
No,
like that?
not at all. No, it wasn't at all mentioned. Yeah.
So all of the information that you've had to learn, you've had to go out of your way to actually study and get experience and get first-hand knowledge.
Oh, absolutely, yeah.
Wow. And with you and the herbalist side of things, how did you find this plant? Have you always been using it? Has it been something quite new?
It's very new. I've probably only been working with it the last 2 years, as in learning and getting more skills with its use. But same as Anna, like the colleges in New Zealand, they don't touch cannabis as a herb, and that's predominantly been because it's been illegal. But as we're getting closer and closer to the opportunity of having it accessible, some of the colleges are looking to, improve and increase the cannabis content that's taught, because it needs to be taught in such a way that practitioners, and it could be general practitioners as well as herbal practitioners, get access to good quality information.
So why is it so difficult right now? Why is nobody talking about it? Why the doctors seem to be avoiding it? They don't seem to know much information about it. Where's this break in communication happening?
So before the 1st of April, we weren't legally able to prescribe medicinal cannabis. There was actually only one product that could be prescribed, and that was Sativex, and it was for a very narrow indication, which was to do with spasticity and multiple sclerosis. So for most people, in the medical profession, there wasn't really a way of prescribing cannabis. So that's one of the barriers. And since the medicinal cannabis scheme has come in, we still have barriers, because at the moment we still do not have affordable products to prescribe. And I think this may be one of the reasons why many doctors are slow, let's say, to come on board, is because of the cost. And it's quite hard to recommend a product that's going to cost maybe something between $3 and $10 a day to be on.
So how many products are available for you to actually prescribe?
There are some CBD products, so they can be prescribed. Any doctor can prescribe CBD. And it used to be that people could bring CBD products in from overseas, but they stopped that with the medicinal cannabis scheme on the 1st of April. So now they need to be prescribed, and we have to prescribe only products that have been approved by the Ministry of Health. And there's a handful of those products that have been approved. And they're all quite expensive. Okay, so that's a big barrier. And then in terms of products that have THC in them, there's even more of a barrier. So apart from Sativex, which I now can legally prescribe, so I can prescribe a THC-containing product from the 1st of April of 2020, but the only product that I'm legally able to prescribe as yet is Sativex, and it's very, very expensive.
Do you have an idea of how much a Sativex prescription would cost?
Yeah, it's about $950 to try it. That would be the cheaper side of the quote. Some pharmacies are quoting more than $1,000.
Wow. Huh. And how long would that last for?
Well, that is the question. It depends on how much you use. It may only last a month if you're using high amounts of THC. So I certainly don't recommend it for anyone who is already using cannabis.
Is that saying Sativex is the only medicinal product available for these ailments and these diseases?
There is one other pathway at present, and that is to get a special authority number from the Ministry of Health to prescribe a product called, it's Tilray, and it's called Tilray 1010. And so that is the most cost-effective THC-containing product that is available right now. It's approximately $170 for a 40ml bottle, and depending on how long that lasts, that could last you maybe 2 months. Yeah. So that's not so bad. So that ends up being about $2 a day to be on that product. So we have at the Cannabis Clinic a number of people taking up that option. But the health department is still putting barriers for patients to access that product, because at the moment it has to be a special authority, and it has to be, so that's a complex form that the health department requires us to fill out, and it also has to be signed by a specialist, a GP. Even a GP like myself that's specialising in cannabis has not been deemed to be suitably qualified to apply for that special authority.
Which seems crazy to me that you have the authority to prescribe opioids, benzodiazepines, all these different pharmaceuticals that have been known to actually cause overdose and kill people, yet cannabis that's never killed anybody ever, you have to go through hoops just to be able to prescribe one patient.
Exactly. You've hit the nail on the head there. It's crazy.
How long would you see it taking until the medicinal scheme can actually function the way it should be functioning?
Well, that is $1 million question as well, because it's 6 months already and it hasn't happened yet. So we've had 6 months where patients have not been able to access cannabis, even though our legal system has said that they can. Yeah.
So when people need to get the cannabis and you can't prescribe it, I guess that's when they turn to other means. And so a big question for people is medicinal cannabis prescribed from a doctor the only way cannabis can help people, or is there other ways to use cannabis? Is there other products possible?
Well, that's the only legal way. So the other way would either be products that a person had made themselves, possibly grown, possibly manufactured and possibly, taken themselves, or the other option is to access the cannabis community and find something which is called a green fairy. So that's in general what happens. But the difficulty with green fairies, as wonderful as they are, is that they have a range of products and a range of skills. And so one of the things that isn't available currently is the pathway for the herbalist. And so that herbalist has similar skills, let's say, to a GP, in as much as there's the medical knowledge and then there's the practitioner capabilities. And then there's that green fairy, I guess, aspect of also growing plants, also manufacturing and also dispensing. And I'm not saying that every green fairy does that, and I'm certainly not saying that every herbalist does that. But that's our other opportunity, to have plants from the garden which are made into a product. Sometimes they can be tested. We've had good results with support around our testing for some products. And then it's pretty much similar to Anna's comments around then the person themselves have to kind of see whether or not that strain or that medicine or that product fits in with their indications. So it can be a week of balance to make sure that strain is absolutely right, which is quite different to the pharmaceutical product too, because it's like a standardised amount that each person is given within reason. So they're two completely different pathways, but there's also this third one missing in the middle, which is a specialist called a medical herbalist, and that specialist, their scope of practice is medical herbs.
And that's where recreational legalisation would open the doors for people like that to come in and actually be able to create herbalist medicinal products from cannabis that can actually give just as much benefit as these these GMP lab created products.
And also the referendum is the only thing on the table at the moment. So without the referendum, green fairies and medical herbalists and any other practitioner that wants to access and prescribe cannabis, they don't have a look-in. So until the recreational adult use is decided on, then those other pathways can start to establish themselves. But currently there's no scope there.
And so that's a very important point to make, is that this isn't a lot of people, especially, maybe I don't mention Dr. Mark Hotu, other doctors saying that this is about recreational cannabis, this has nothing to do about medicinal cannabis. What would you have to say about that?
I say to quite a few patients, some patients who've already had the prescribed cannabis, I say to them, if you were to consider voting yes, what it might mean in the future is that you don't need to ring someone or meet someone or get a package in the mail, that you might be able to go to a dispensary and talk to someone about your sleep issues, which is around anxiety, buy a recreational product which actually allows you to sleep and not be anxious. So that's the difference, I guess, between we've got this, recreational and medicinal, and like I said in the beginning, there's a huge amount of overlap.
So recreational products can be used for medicinal uses, and that would make them cheaper, I assume, rather than these $900 a month kind
Absolutely.
of prices.
And the other thing is we would have access to whole plant products. And what I understand is that there is a lot of potential therapeutic benefits in whole plant products. So we're talking like juicing cannabis or cannabis teas. Raw cannabis has a lot of therapeutic cannabinoids in it, which are non-mind altering. They haven't really been explored because we haven't had the freedom to explore them. And this whole kind of the recreational, in a way, is a little bit of a distraction.
It is.
But basically what prohibition means is that there is no freedom to explore these possibilities. And I mean, I genuinely believe these possibilities have some huge potentials to help people. But I also think the medicinal products have huge potentials to help people. And I also think that the artisanal products, or the people that make, maybe grow their own and make their own unique products, also have something to offer. Like, I think they can all help people. That's why I'm one of the reasons I'm very, very strongly for, prohibition being lifted.
So coming from a doctor then, you are saying that yes, there's a place for medicinal cannabis, but not everyone should have to come and get a prescription and go through this ridiculous process of having to get a specialised approval, paying $1,000 a month. You're saying that from your experience, people could get these medicinal benefits from recreational products?
I think so, but I do feel that there is a medicinal pathway that I think is probably going to be very, very helpful for a lot of people. The advantages of the medicinal pathway is that we have products where we know exactly what the combinations of cannabinoids are in them, and they have been, they've been basically grown, optimal conditions, all of that sort of thing. And
they're expensive to make, aren't they?
Yeah.
Like, that's the cost, the making of it.
Yeah, they're
GMP
expensive
labs.
to make.
Yeah.
But then also all these various controls as well. Like, I mean, for instance, CBD. I mean, in countries where cannabis is legal, like California and say Canada, you can buy over-the-counter CBD products probably for about half the price that we have them available here. So we have availability, but we have, with a lot of controls and a lot of extra costs.
So I think a good point to bring up then is some people out there might listen to this and say, but the reason it's being prescribed is for safety, whereas we understand that CBD has very little side effects, if none, and THC has some side effects, but comparatively to other pharmaceuticals, it's very small. From your experience, have you seen many negative side effects from these medicinal cannabis products?
It's a good question. I think that there certainly are effects that people need to know about, and so we certainly need education around these products. Now, who gives that education is, a question.
Yeah.
It certainly needs to be people that are knowledgeable about cannabis. I mean, cannabis has a lot of nuances, doesn't it? It has a lot of really potent effects. So to misuse cannabis could be detrimental, absolutely. So I mean, and so that's certainly the case. So we certainly need education, but we don't necessarily need it has to be a doctor or it has to be a specialist. And I think that what we're seeing at the moment is that cannabis is out there. Cannabis is already here. So who is controlling it now? At the moment, we have cannabis, but we don't have adequate education. We don't have adequate pathways for careers for people to really specialise in it, for people to grow it and specialise in all the growing and all the nuances of creating these, potentially some amazing products. So at the moment we lose on all levels with prohibition.
Cannabis is here now, it exists, people are getting it, but it's not controlled, it's not grown to the top quality, there's no education around it. Any of these negative effects that may happen, people aren't actually getting the help they need and the guidance they need from that, and that's where we want to bring control around it and bring regulation around it.
Yeah, that's right.
And I think the side effects too, we forget that the side effects are good appetite, good sleep, good laughing, you know, and relaxed. And so that's like a wonderful side effect that you would never get from, you know, a majority of medications. So
that's a very good point to make. People who have never used cannabis, they hear side effect and they instantly think negative, but in reality, to feel slightly tired or to feel slightly relaxed is a very positive thing for a lot of people. And others out there on a day-to-day, you don't want it to necessarily feel tired, but that's where the strains become important, right? What you were talking about, where specific strains for specific reasons, indica, sativa, hybrids, different products, the way that they can be ingested. So I think with something to bring up, the difference between your two worlds is, for you, the products are mainly tinctures, I imagine. Can you explain the style of products in regards to ingestion for cannabis in the medicinal scheme?
Okay, so they're basically oils. So the cannabinoids are oils, and they're usually diluted with other oils, and so you just take it as a dropper and you just take it in the mouth. And that's for the CBD products, and also for that Tilray 1010 product, it's an oil with a dropper. Sativex actually is a spray, and it's in alcohol, so it's slightly different. But
mainly those two, though. There's not ointments or creams, edibles, or
so there's all
there's
sorts of
no inhalables
possibilities.
or anything like that in the medicinal scheme currently.
Yeah, absolutely. So it's very restricted in terms of your options too. Yeah.
And that's where people come typically to the grey market to find those other products, right?
And what is it? Is it a grey market, a black market, a green market, or an illicit market? It's got so many names, but what it is it's just a different pathway. And
it exists. It's right here now.
It does exist.
Yeah.
In fact, it's almost the elephant in the room with regard to study. You know, like with what we're doing at the moment, AUT having a wonderful course for people to learn on. The elephant in the room is still the illicit green market, because we want to move beyond that. But in actual fact, we have to accept it, and we have to work through that other market in order to get to where we want to be in a few years' time.
I think it's a good point to bring up, though, is that the illicit market, the black market, it actually involves a lot of people trying to help others. It's not just about getting high. There's people out there creating edibles, creating oils, and creating butters to genuinely help people, and they want to become legal. They want to be able to do this all properly, but they're not allowed to.
No, and they'll need to find the right part of the large cycle to work within. You know, there are people who want to do every single part of it, and it might be that their skill set is in growing, or their skill set is in manufacture, or their skill set is in dispensing. And so I think the way that the medical scheme's been set up for doctors is going to be comparable to what the scheme has been set up for recreational use, you know, so that there is an opportunity for that herbalist or green fairy or producer to actually have a legal licence so that they can work within that cycle and provide, like you say, that health and healing for other people. That is all they want to do. Sometimes a little bit of information, you know, can be a bit dangerous. So there definitely has to be room for education across the board, and room for stepping up to sort of really take this medicine, you know, in its place. To do with dosing, I would always start with having that conversation about green juicing, and we find that there are people who, if they have a tendency to need a lot of cannabis medication, that one way of accessing it without any psychoactivity, because they're getting the THCA, the acid form, it allows them to consume quite a lot of raw, fresh, green cannabis on a regular basis, which reduces their need for any other type of cannabis medication. And then the other ways that people take it is under the tongue as an oil, as a FICO product, so a fully extracted cannabis oil. And then there's also infused oils that some people will make, which is literally like you'd make an infused oil or vinegar in the kitchen. You know, it's just soaking the product for several weeks and having that process made. And then there's also tinctures. So way back in the day, that's all herbalists, you know, would rely on, is that herbal tincture to provide an accessible but quite a concentrated form of medicine, so that you didn't have to drink 2 or 3 mils. You literally took through 2 or 3 drops. And as far as edibles go, or medibles, marijuana edibles, there's some real benefits to those for long-term pain in the day, but certainly they're probably, of all of the products, the one that you would treat with a lot of caution, particularly for people who eat a product and then find that it's not doing anything, and then perhaps eat a little bit more. And that would be like the rookie mistake, of not eating too much until you've found out what the previous ingestion has caused.
Yeah, and that's where people's individual experiences are going to become important, tolerances are going to build. I think something I want to bring up is the actual inhalation of cannabis, because people tend to avoid that topic, when in reality there's vaporizers, there's possibilities to actually inhale cannabis very safely, and it has just as many medicinal benefits. In your mind, do you see inhaling as a way for medicine?
It would be one of the last things that we'd recommend, and it would be again individualised. So if there was someone who found, for example, there's a young man that's in the community and he has epilepsy. But he's 19, he doesn't want to be looked after all the time. So he has access to a vape, which he can start to draw on should he feel the seizure coming. And that is looking as if it's going to reduce the seizure activity that he's already managing through a cannabis regime. So for someone who wants to be independent and also who wants to have access without having to move towards, the kitchen to get the product, you can usually have a vape or something which will give you a very, very quick reaction. And similarly to Parkinson's, similarly to even nausea, with withdrawing it in instantly, within sort of minutes, you get a relief. And that's quite different to a product which is going to take possibly 40 to 60 minutes to start to have some effect.
And I think that's important to realise, is that the ingesting, it takes an hour, sometimes even 2 hours to...
8 hours for one person.
Yeah.
8 hours. And
It's quite variable, yeah.
Everyone else in the group was well and done.
So inhaling, it gives you that immediate effect, and it's not as long lasting either. Yeah. So there's actually a lot of potential for dosability in the inhaling. Yeah. And I think it's an important point to bring up, is that as much as it's your last recommendation, it's not actually as harmful as people think it is and keep making it out to be. People can keep comparing it to the tobacco smoke.
Yes.
From my understanding, it is completely different. It doesn't have the carcinogenic effects, and it doesn't cause any kind of hypertension or cardiac symptoms. So I guess in the medicinal cannabis scheme, that's a complete no-go, right? There is no
Not
forms
as
for
yet,
inhalables.
although my understanding is that in other countries it is an available option, and it's recognised as being, just as you say, an option, particularly for acute pain. It's seen as, because it's so much more quick acting than the oral. I was just going to say, I agree with you that CBD oil is much safer than paracetamol. It has a much less toxic profile. For instance, you cannot overdose on CBD oil, but you can overdose on paracetamol.
But yet you can buy it at the supermarket for $2 a packet. You can buy as much of it as you want, and yet people want you to have their special prescriptions.
Yeah,
something like
I know.
CBD.
Yeah.
It's only because it's made from cannabis. Otherwise, there would be no justification. Yeah. And I say that to patients. I say, look, in many countries this is an over-the-counter product. In Europe, it's over-the-counter. It's classified as a novel food in Europe, and in the States, it's an over-the-counter product. And apparently, in the States, 6.9% of the population are now using a CBD product. So it's become like a major phenomenon there. And I don't think for no reason. It's because CBD has a phenomenal profile of therapeutic effects.
Going back to the acute use, so the FICO oil, which is very concentrated, with something like a headache or a migraine that's coming, that person knows it's coming, applying it topically to the temples will have an immediate cerebral, context, because it actually, within probably 10 to 15 minutes, you'll get a reaction from there without even taking it under the tongue.
Oh wow, so the creams can work.
Well, this is just the oil, so it's not even a cream. And also the oil can be used in the belly button. So the belly button is a port of entry, if you like, for quite a lot of cellular distribution in that place. And so Ayurvedic medicine has this idea that pouring oil into the belly button is a great portal for accessing the rest of the lymphatic system. So with children, and certainly with people who are just learning about the oils, a very gentle way of introduction is through the belly button or on the temples prior to any type of ingestion.
Wow, I did not know that. That's amazing. So there's multiple different products and different ways to administer it, and that would fall under a herbalist style, right? And there we go, that the issue is we're so used to being conformed into thinking of prescription drugs, GMP labs, doctor prescriptions, yet there's so many medicinal benefits of this plant in other directions.
And wait, there's more. So we've used it as suppositories and as pessaries. So for suppositories, predominantly for abdominal pain, so gentleman who's got severe abdominal pain with a cancer diagnosis, the main thing that's managing that man's pain is suppositories. So although there's dosing going here and there's spot dosing is required, that's the mainstay of his care now, and he's moving into that palliative stage.
So with all of these experiences that you're having, and it's undeniable the medicinal benefits when you see it with your own eyes, why are there some doctors out there against legalisation?
Doctors or just people?
I think doctors are just people. Yeah. And I say pride and prejudice. I think there's a lot. We all grew up with this prejudice about cannabis, and and also maybe the only times we become aware of cannabis is in a negative light, isn't it? Yeah, like people don't really go around saying, "Oh, I'm using cannabis." And
it's helping me so much.
Yeah.
Because it's this black market thing, right? So you've got to keep it secret.
Exactly. But that's something that really opened my eyes was just talking to people about their cannabis use and having these conversations with people who are very successful, but they use cannabis. So, but those people will not, they won't be shouting it out to the world. But there's a lot of people that actually use cannabis and find that they are more able to do whatever it is that they do well, to do it even better. And particularly with the CBD and low THC products. Yeah.
Well, going back to doctors, I guess, and I'm not one, but I always imagine that if you're a doctor, why would you want to start learning about herbs? Why would you want all this herbal kind of expectation, which it is herbal in my world, to go on, to that GP successfully with a practice? Why do they need to add on a whole new learning model? Because the endocannabinoid system is not just a quick understanding. There's a lot involved. And I can imagine that unless there's a really good force behind that patient asking, demanding, requesting, and then accessing a cannabis specialist, unless there's that push from people, I think doctors will possibly just keep doing what they've already done. There's certainly a lot that say they've got reluctance around getting to learn about cannabis because it's a whole new field on top of their very, very busy fields of study already.
Yeah, so and then you add in the barriers of cost. Yeah. So not only are they not experienced, and it's complex, and there's all these different nuances. There's the cost to the patient. So you're not necessarily going to be in your busy general practice saying, hey, what about CBD, or how about we do a complex special authority form for THC? It's just not
It's so much easier to go, hey, here's a $5 prescription for opioids, see you later.
But also it could be a one-off prescription for that person and then they simply can't keep going.
Yeah.
You know, so that's a lot of time invested with that doctor to sort it all out and then it just goes nowhere.
That's right. And also, I mean, I think the patients need to be quite well educated. And I think that's why the cannabis clinic has been working and why I've got this experience now. Is because they seek us out. So it's actually patient-driven, not doctor-driven. And I've noticed that in my other general practice, if I suggest maybe medicinal cannabis, the person isn't necessarily ready to take that on, but they do go away and think about it, and sometimes they come back to me some weeks later and say, yeah, I think I would quite like to try this because I've thought about all my other options and actually this is a safer option. But yeah, there's costs and there's barriers and those things can be quite off-putting.
To understand that as a doctor, you don't want to, when there's a $5 option and a $400 option, it's hard to say to someone, hey, do you want to think about the $400 option? Because most people can't afford that.
And sometimes they need family support too, whether it's a child or whether it's an older person. They almost feel like I need the team behind me before I can say yes to this, because it does stigmatise them to some degree, whether it's pharmaceutical or whether it's another product. Not everyone can come out then to their family. They probably can more with a pharmaceutical product. You know, the doctor's given me this. But even that would create quite a few conversations for some families.
Yeah.
Sure. What I think that stigma is the biggest limiting factor, because people don't assume that this is the face of cannabis, that they have this impression in their mind that it is long-haired, hippies, barefoot, and even those people know what they're talking about, but that's the stereotype that everyone sees in their mind. They don't see yourself, and that's a really difficult thing to try and combat the stigma, because all the information's there. At the end of the day, if you actually go out and study or educate yourself, you're going to see what we're talking about, but people won't even listen. That's the really difficult part, and that's what I was talking to you two today, to hopefully to get people to actually listen to these points. I think something we should address is the potential harms of cannabis and get that perspective from you as a doctor, and where we can then mitigate those harms and how we can deal with those harms. So from your experience, what would you say are the potential harms of using cannabis?
The big harms or the big questions is young people, and I'm really talking the under 20s, using cannabis a lot, you know, so in a way sort of opting out and using cannabis as a way to opt out. And I think that is a concern, and I think a lot of parents have that as a concern. But what I would say is that that's happening now. And in fact, young people are the ones that are using more cannabis than anyone else right now. And actually, so we've got the wrong demographic using cannabis. And why have we got the wrong demographic using cannabis? I think because we've got prohibition. If we didn't have prohibition and we had sensible controls, a lot of young people would, just pass it. And apparently that's what's happening in Canada, you know, that they've actually got less young people using cannabis than ever before since the prohibition was lifted.
Just to put the fact out there, it is a 50% reduction in youth use, and the only increase in use has been 65 plus. Everyone else has remained the same, because those that were going to use cannabis were already using cannabis. Yes. Now they're buying it from a legal market, and the stats have come out that 70% of people have turned to the legal market within 1 year. So people were already using cannabis, they were just buying it from the black market. Now that money is actually being put into the proper system, taxes being paid, that tax is being spent on schools, police, mental health, and the whole industry that was already existing is now being controlled and regulated. And that, to me, is a no-brainer, but how do you get that across to the normal, everyday person?
Yeah, because the risk group is actually the risk takers, isn't it? So the at-risk group are the risk takers, And so, by making it, prohibiting it, we're not actually going to help that group. In fact, we're going to make it even a bit more, exciting.
And it also puts them in the shadows, so if they do have a negative effect, they're not going to come out and talk to their doctor, they're not going to talk to their teacher or their parents, they're going to keep that to themselves. And I think that's the biggest problem we're finding is the harms can be mitigated by actually opening the communication doors, and right now we can't. From your experience, have you seen negative side effects of cannabis?
I definitely have if people have taken too much, and that would be a negative effect of someone who had never had any experience in their whole life, and they were surprised, at how much impact the medicine had. And I think what happens with that person is that if they get a negative kind of first experience, that they're not really keen to keep going. And that's a shame if they are over 65, and there could be a lot of benefits for them in using that medicine.
So that's where education is very important.
But education that's accessible too. Like there's people who are doctors and professors and scientists, but there's lots and lots of lay people, that really want to learn a little bit more, almost at the gardening club variety of like, how do you grow it? How do you harvest it, and what can I make with it? And I think that's an area that once the recreational referendum is looked at clearly and changed, let's say it changes, it might not, but let's say it changes, what that will give people is the ability to have a chat about what they've grown, or have a chat that they've got some nice CBD, or have a chat that the THC that they've been accessing has stopped their migraines. In a barbecue setting, without someone going, well, obviously they need to sit over there. Like no one puts a tramadol user in the cupboard. We go, oh, are you in pain? You take more tramadol, that will help. So it's kind of like, if you're in pain, shouldn't anything that is safe and, not affecting other people obviously going to be okay? Or why is there rules about this particular, I call it a plant, lots of people call it a drug. But what's the difference between this plant and all the other plants that we have access to?
Yeah.
The difference is a lot.
The difference is it's safer.
That it's got therapeutic actions. Yeah.
So how do we, these harms, and you've said youth use and you've said uneducated use where people are having too much. Therefore, how do we mitigate these harms?
I think increasing knowledge. And I have the thought about alcohol and how we, parents kind of help their children to negotiate the alcohol. Yeah, and if the parents have a good knowledge and a reasonable relationship with alcohol, usually the children end up similarly. So we need something similar, I think, with cannabis. We need a lot of elders knowing about cannabis, knowing about what intoxication cannabis looks like, and how long it's going to last, and what sort of things we can do to help it, and mostly about reassurance and figuring out how to negotiate it.
That's such a good point. You're right, because adults have experience with alcohol. They say to their kids, don't drink more than this amount because you'll get sick. If you do drink too much, you'll vomit, and what you need to do is clear that vomit out. You need to eat some food, you need to have a cold shower. Kids get educated on how to deal with the ridiculously negative side effects of alcohol, but yet with cannabis, it's like, don't speak about it, don't mention it. If you are using it, go to the garage and don't come to me with a problem. It's like, it's craziness. Can you imagine if we did that with alcohol? How much more harm there would be?
But one thing that Anna said was about self-responsibility, which as, herbalists and GPs, ideally the person who comes to see you already knows that they're responsible for their health and you're going to help them. One thing that we're really a bit off about is self-medicating. So we want them to have self-responsibility, but we're a bit nervous about self-medication, especially for the under 20s who maybe are taking too much. But where that sort of self-medication comes in with the whole plant extract is that you need to be intuitive about your dosing. Now, when you take a pharmaceutical product, whether it's paracetamol or Tilray, you look at the product and you take it as per the instructions. You might reduce or change it or even alter it if the GP or if the herbalist says, don't worry about what's on the label, this is what I want you to do for you particularly. But that all goes out the window with the other products, because what might suit you or you would not suit me. And so if I have the same dose that you have, one, nothing happened and I think, well, that was a waste of space, or too much happened and I think I'm not going back to that again, that was too scary. So self-medication has got a really bad rap, but actually self-medication, it can go badly. But it can also become intuitive around how many doses do I need? Do I need 1 dose for my pain today, or do I need 3 doses for my pain today? And that becomes kind of like a dance with your symptoms, like a dance with how am I feeling today, which is what we all do when we wake up. How am I feeling today?
If you think about it, we do it with alcohol. People are like, I'm going to have 3 or 4 drinks. Some days 3 or 4 drinks makes me a lot more intoxicated than other days. So you intuitively,
we know it.
Each drink, you go, okay, I'll stop there. Yeah. Why do we not do the same? Why can we not see the same with self-medication? Something I would like to bring up, because we're going to run out of time soon. We've got about 10 minutes left on the cameras. These harms we've talked about, kids getting access and having too much, how do these harms weigh up against current prescription drugs?
Yeah, it's a good question. I mean, obviously they're different, but I think that one of the reasons I'm excited about cannabis medicine is that actually it's very safe, as long as we learn how to negotiate, potential, too much or not enough. So the dose, you've actually got a very, very safe product. So you've got a product that protects the nervous system rather than damages the nervous system, and you've got a very, very wide dose. Low toxicity, so you can take a lot and it's not toxic. So that's in a way why one of the great advantages of medicinal cannabis versus other pharmaceutical options.
Like opioids.
Like opiates, for instance.
Dependencies and overdose.
Yeah. So I'm seeing a lot of people wanting to come off their pharmaceuticals and use medicinal cannabis instead, and I think that's a really good option. Lots of people who are on, say, antidepressants want to come off their antidepressants, and sometimes that can be really hard coming off. I mean, they're relatively safe.
Yeah, without somewhere to land.
Yeah, they're relatively safe, but again, you can overdose on those. They definitely have a toxic profile, and they can be difficult. They can have withdrawals, so people develop tolerance and withdrawal with those drugs. So, and then some of the other drugs that are much more toxic, like the ones that are given to patients for neuropathic pain, for instance, they can have a very severe toxicity profile. And then, of course, what you talked about, the opiates, I mean, they are very addictive, cause tolerance, and potentially can cause a lethal overdose.
And I think a really important point to bring up about opiates is people talk about the psychoactive effect of cannabis. If you take multiple opiates, you definitely have a psychoactive effect.
Oh, I've heard that from quite a few different conversations.
This is where my passion for cannabis came in, because I took too many tramadol in one day, and I've never, to this day, had such an adverse effect from taking something than I did from taking too much tramadol. I was completely spaced out, didn't know where I was, vomiting, shaking, migraine, all types of problems. And yet that's totally normalised. And those effects are never talked about as psychoactive. Oh, you just took too much. Well, yeah, same with cannabis. You took too much.
Yeah.
It's a really interesting point.
Yeah, and it's interesting also, even if you do take too much cannabis, usually people do retain their awareness that they've taken too much, and so they can then, stop what they're doing and, basically go and lie down.
Well, they either fall asleep where they are, or they eventually find themselves in bed.
Yeah. But of course, there is the issue that sometimes it can catch them unawares. I think that is a risk with cannabis.
Yeah, and the older person, we were discussing that the risk is of falling. There's always a risk of falling, so that has to be taken into account.
I'd imagine that would be very similar with opiates as well, though.
Oh, absolutely. Opiates in the elderly are quite a dicey combination. And actually all of the different pain relievers in the elderly have a hook. And I would say that if we could get medicinal cannabis a dose that doesn't cause intoxication. In the elderly, you've probably got the safest pain reliever.
Could you imagine it in an elderly folks' home, an older person's rest home? You know, the amount of medication is there to keep them calm, to keep them asleep, you know, to have a great day, and also pain medication. You know, like if some really brave rest homes, you know, actually had a cannabis consultant come along and talk with the GPs who are in that area, could you imagine what you would change in those lives for people who would get clarity again, a sense of purpose, no pain, and be able to be active in their lives?
That's such a good point that people don't realise that we're talking about Parkinson's disease and all these diseases, but in reality, old age causes a lot of symptoms, and people are using prescription drugs every single day to deal with those old age symptoms that can be replaced by using a natural product like a cannabis-derived substance. So it's just so hard. Like, I have a grandfather who he would massively benefit from using cannabis, but he used to be a pharmacist and he's so against it. He believes in the pharmaceuticals, but it's how do you deprogram 60 years of a thought pattern? It's almost impossible.
I think, you know, CBD is quite a nice way in.
Yes.
I think a lot of older people are open to CBD. And I can be so reassuring to any person who starts CBD that they're not going to get any sort of mental impairment. And so with that, they start a journey of finding out what cannabinoids can do. So, and CBD in the elderly is so well tolerated.
Yeah.
It's amazing.
Yeah.
So I think of that as a first step for that group, but actually probably for everyone to maybe start with something really safe like that, and then step 2 would be to add in something that potentially has a psychoactive effect if we take too much.
But if it was a cream, if it was a topical, then you could have the application for that person with no psychoactivity. So for someone who's a little bit resistant, a topical might be an easy way to start. You know, like great relief, you know, in a short time.
Yeah, very good point.
And then all these raw options too, you know, that are non-psychoactive, but have potent anti-inflammatory effects. Immune boosting effect,
anti-seizure,
neuroprotective effects.
Yeah, we are so missing out on these, you know, and we need them because this is our operating system, our nervous system, and cannabis is actually medicine for that.
So we're coming to an end. So I want to ask a question to you both. In your eyes, what is the future of cannabis in both New Zealand and the rest of the world?
Well, my answer would be different than what I would have said 6 months ago. Now, I think it can save New Zealand's economy. That's what I see. And I think we wouldn't have even discussed the economy 6 months ago. But we have, you know, like in your video, we've got a perfect belt through, you know, the upper South Island of which we could grow the most amazing products and look after the health of New Zealand and export, you know, everything that is bountiful about our clean and green. And I think it will also possibly mean that we look at our clean and green, because if we want it to be green, it has to be clean, and we're not very clean and we're not very clean. So I think the economy and all the other trickle-down effects are great, but I see that the biggest thing now is actually giving us a purpose and a direction to get back on our feet.
I agree with you, but I also see huge potentials for a lot of health conditions that people are struggling with. I'm seeing huge potentials to help people with mood issues, depression, anxiety. We now have, you know, with CBD and things, a safe option for anxiety. We were talking before about the young people with quite challenging diagnoses like autistic spectrum, ADHD. They all get benefits from cannabis products. But then you've also got your older group with all their chronic pain and arthritic conditions and muscle tensions. You've got your chronic fatigue people, your fibromyalgia.
Who wouldn't you prescribe it to?
Exactly. You've got all the people, and we're all suffering in different ways. So cannabis can actually be very, very helpful for a lot of people.
I do have one last question. I was going to just finish now and ask for your final thoughts, but I think something we should address before we leave is this fear of the psychosis aspect of cannabis, where people think legalizing is going to cause more harms, when we know that it's actually going to help more so than affect negatively. But can you give me your professional perspective on, do you view cannabis as dangerous for the mental health of New Zealand?
No, I don't actually, because I think within the plant is actually the solution to that. I mean, we know that, again, I'm talking about CBD, and the research is showing that it actually is protective for psychosis. They're doing research as an alternative to antipsychotics with CBD. So I think, again, the answer is actually an increased knowledge about the plant and the proportions of the cannabinoids, how we use it. All of those things are going to contribute as to whether this is a negative or a positive result with the individual person.
Yeah, and I think supporting health practices, whatever the model is supporting it in such a way that people can access it and they want to access it, because there's just about every known possible affliction could be helped in some way, so I think it can only be a positive in the right hands.
Something I think is really important as well, because a lot of people talk from their outside perspective who have never experienced mental health issues, and I like to bring up the point of correlation doesn't mean causation. Because someone's using cannabis and they have mental health issues doesn't mean the cannabis caused that. In reality, they may have had the mental health issues and they're using the cannabis for the symptoms of that. And coming from someone who suffers with a lot of anxiety and has suffered with depression, the cannabis has not caused that. I'm using the cannabis because I'm suffering. And that's a really important point to make to people, because they see one thing and they just instantly say, oh, that person's life is the way it is because of the cannabis. No, they're using the cannabis.
And that word too, like when you're on insulin, are you using insulin? Are you using paracetamol? Are you using hydrocortisone cream sometimes? Or are you taking it? So every cannabis person is a cannabis user. But we're not insulin users.
We're not tramadol users.
So even our cultural words imply that we're in trouble because we're taking this medicine. And I think there's so much cultural shift that's going to occur very soon. Like culturally, instead of drinking a yardie at your 21st, it could be that your grandma gives you a joint. A lot of things are going to start shifting, and that's a safe time to have it at your 21st. Like, wait for it. Good things are coming. It doesn't all have to happen at your 16th. So I think culturally what we'll see is that stigma is slowly removed as more and more people are acceptable around, people taking medicine, including your grandma.
And isn't that a really interesting point, that it's completely normalised for your whole family to get around you and watch you scull so much alcohol that it can't even physically fit into your stomach, so you vomit, and then everyone cheers, being like, yay, you vomited from your yard glass.
That's what we've got currently, so anything has to be better than that, even if it's brownies for your 18th, And I think that normalising of actually that's enough brownie, or that's enough beer, that's what we're looking to as well.
So to finish up, I would like to ask what is the final message you would like to say to the people of New Zealand leading up to the vote? I'll start with you, Anna.
I feel like Prime Minister.
I would just say vote yes to legalise cannabis. That it's actually a win-win on all levels. It's going to be more helpful for protecting the vulnerable, and it's going to mean more options for medicinal options.
I would say vote yes for the recreational adult use referendum, as it provides New Zealand with so many more options that it currently has.
So right, and that motivation to actually get out and vote. Please, especially the younger people, get out and vote. The people in your year demographic tend to be voting no, so it's a really, I'm so grateful to be able to come and have this moment with you to talk, because like I said, me saying these things is one thing, but having it come from people like yourself, I think it brings a lot of power. So I'm hoping that the people out there, if your grandparents aren't on social media, please show them this so that they can actually be educated as well. There is a lot of medicinal benefits from cannabis, but we also actually can't get the products we need for those medicinal benefits. So the reason why we want to legalize recreational cannabis is to open up the doors to be able to bring in more products at a cheaper price and actually help the people that are at harm and mitigate that harm by bringing it into a controlled system. Yeah, thank you so much. I really appreciate your time, and hopefully next time we're talking, we'll have a smile on our face and we'll be able to have a specialized herbalist in cannabis, and you'll be able to actually give the medicinal products that you desire to give to your patients. Yeah, thank you, and we will cut.